Hello everyone. Now we are going to discuss about very important topic, Universal Immunization Program. And myself, Dr. Anusha, Assistant Professor in the Department of Community Medicine. So this is very important for short notes, as well as each and every student will be asked about one or the other vaccine during their Viva. Um, Before we call it as universal immunization program, previously it was used to be spoken as expanded program on immunization. So usually they used to give for 6 vaccine preventable diseases, and the CPA term was coined in 1978, and after that now we are calling it as universal immunization program. And as a component of universal immunization program, national immunization schedule we are following, and this is a part of reproductive and child health program, and we are running it under National Rural Health Mission of India. Now we will discuss about all the vaccines which we are giving under the government of India, starting from birth till 16 years and including during pregnancy. And at birth, what we will give, first of all, as soon as the child is born, the baby is born, we are giving BCG vaccine. BCG means Bacillus calmette guerin, and it is prepared from Danish 1331 strain. And how much we will give and where we will give means, if the child if we are giving within 1 month of age, we should give 0.05 ml, or after 1 month of age 0.1 ml. And the route is intradermal route, and where we will give means left deltoid or left upper arm. LUA means left upper arm. And if we are not giving BCG at birth, we can give till 1 year of age. This is about BCG, and BCG vaccine will be given for the protection against tuberculosis disease. And again at birth, what other vaccine will be given means OPV vaccine. OPV means oral polio vaccine. So this is live attenuated vaccine. OPV 0 dose means at birth we are giving. And how much we will give? 2 drops orally. And what other vaccine we will give at birth means hepatitis B 0 dose. So this is against hepatitis disease, hepatitis B. And we will give 0.1 ml of hepatitis B vaccine intramuscularly we will give. And AMT means anterolateral aspect of the mid thigh. So, how many vaccines we are giving at birth means BCG vaccine, OPV vaccine, hepatitis B vaccine. And if we are not giving hepatitis B vaccine as soon as the baby is born, we can give within 24 hours of birth. And OPV 0 dose, if we are not giving on day 1, we can give within 15 days of birth. So now at birth vaccines are over, and now we will discuss at 6 weeks of age what we will give, 6 weeks or 1.5 month. So first one is pentavalent vaccine. As the name suggests, pentavalent means it has 5 components. That means it is effective against 5 diseases. It contains DPT, hepatitis B, Haemophilus influenza. DPT means diphtheria, pertussis, tetanus. Hepatitis B and Haemophilus influenza. So it is effective against 5 diseases. And this pentavalent vaccine we will give 0.15 ml of dose. Route is intramuscular at anterolateral aspect of the mid thigh. So the newborn gluteal muscles are not well developed. That's why we will give to the lower limb. And in the lower limb also, anterolateral aspect means it is not containing any nerves and vessels. Anterolateral aspect. So that's why it is safe to give at anterolateral aspect of the mid thigh. This is about pentavalent vaccine. And the next is OPV first dose we will give, oral polio vaccine first dose we will give 2 drops orally. And other one what we will give at 6 weeks means rotavirus first dose, rota 1, and this also orally we will give. And if we are giving rotavac means we will give 5 drops orally. And if we are not giving rotavirus vaccine at 6 weeks, we can give within 1 year. But the first dose we should not start after 12 weeks of age. If we are starting the first dose of rotavirus vaccine after 12 weeks, means there is a chance of intussusception. Risk of intussusception will be there. But the second dose, third dose, if we are missing at 10 weeks and 14 weeks of age, then we can give within 1 year of age. And even pentavalent also, if we are missing at 6 weeks of age, we can give till 1 year of the age. And next is injectable polio vaccine. So IPV, first dose also we will give at 6 weeks of age. And the dose is 0.1 ml and route is intradermal. ID means intradermal. And where we will give means right upper arm. We are giving BCG at left upper arm and we are giving IPV at right upper arm. And next vaccine at 6 weeks is PCV, pneumococcal conjugate vaccine. First dose will be given. So this is also given at anterolateral aspect of the mid thigh, and the dose is 0.5 ml and we are giving intramuscularly. And pentavalent OPV1, Rota1, IPV1 and PCV1 will be given at 6 weeks of age or 1.5 months. And next what we will give means at 10 weeks or 2.5 months. Pentavalent second dose will be given, oral polio vaccine second dose will be given, and rotavirus second dose will be given. Here we are not giving injectable polio vaccine and pneumococcal conjugate vaccine. We are not giving it 10 weeks of age. After 10 weeks, 14 weeks of age or 3.5 months. Pentavalent third dose will be given, oral polio vaccine third dose will be given, rotavirus vaccine third dose will be given, IPV2. Now we are giving IPV2, not IPV3, and PCV2, not PCV3. After 6, 10, 14 weeks, we will give at 9 to 12 months of age. 9 to 12 months of age, what vaccines we will give is MR or MMR. MR means measles and rubella. MMR means measles, mumps, rubella. So it is protective against measles and rubella. So how much we will give? 0.5 ml we will give in subcutaneous. Route of administration is subcutaneous in right upper arm. So this is very important vaccine, MR. This is also live vaccine. Next is JE. At 9 to 12 months, JE first dose will be given. JE means Japanese encephalitis vaccine. And the dose is 0.5 ml and the route is subcutaneous. And where we will give left upper arm. So this is also one of the live vaccine. And third vaccine, what we are giving at 9 to 12 months is pneumococcal conjugate vaccine booster dose. So PCV1 is over at 6 weeks, PCV2 is over at 14 weeks, and now we are giving booster dose of PCV at 9 to 12 months, and the dose is same, 0.5 ml intramuscular anterolateral aspect of the mid thigh. And another thing we are starting at 9 months is vitamin A. So vitamin A we are starting because to prevent nutritional blindness, especially in the under 5 children, we are giving vitamin A. So vitamin A will come in solution form and the dose is 1 lakh international units. So as it is coming as suspension, we are giving orally. So this is about 9 to 12 months vaccines. And next is after 9 months, vitamin A we are giving. Every 6 months we should give till the baby attains 5 years of age. So every 6 months we should give. At 9 months, which is below 1 year of age, we are giving 1 lakh international units. So after the second dose onwards, every 6 months. We will give 2 lakh international units till the baby attains 5 years of age. Only 9 months dose is 1 lakh internationals, rest all the doses are 2 lakh international units. And next is 16 to 24 months. So 16 to 24 months, what vaccines we will give? DPT booster, diphtheria, pertussis, tetanus. First booster will be given at 16 to 24 months. So all that before we discuss 9 to 12 months, we have given to infants. So from this onwards, we are giving to children 16 to 24 months. So DPT first booster will be given at 16 to 24 months. And the dose is 0.5 ml and we are giving intramuscularly at anterolateral aspect of the mid thigh. And second one what we are giving is MR2, measles rubella, second dose will be given at 16 to 24 months. And OPV booster dose, OPV first booster will be given, and Japanese encephalitis second dose will be given, not booster, it is Japanese encephalitis second dose will be given. So DPT first booster, MR2, OPV first booster, and Japanese encephalitis second dose will be given at 16 to 24 months. And as far as JE is concerned, previously this Japanese encephalitis used to be given only in endemic districts. But now in Telangana also we are giving this Japanese encephalitis vaccine in routine immunization schedules. And after 16 to 24 months, we will give at 5 to 6 years of age. So 5 to 6 years of age, what vaccine we will give means DPT second booster, diphtheria, pertussis, tetanus. Second booster will be given at 5 to 6 years of age. And after 5 to 6 years, 10 years you should remember. At 10 years and at 16 years we are giving TT. But nowadays in place of TT we are giving TD. Along with tetanus, diphtheria also we are giving. So this is in single vaccine. TD. In place of TT we are giving TD. So at 10 years one dose we are giving, and during 16 years of age also we are giving tetanus and diphtheria. So, from birth till 16 years, this national immunization schedule is covering. Along with that, national immunization schedule also includes vaccination during pregnancy. So, during pregnancy, what vaccines we will receive means TT or TD. Nowadays, for pregnant women also, TD we are giving to give protection against diphtheria. So, a transplacental transmission of antibodies will be there, which will give protection to the newborn baby against diphtheria. So for that we are adding diphtheria. So TT first dose. So previously we used to give it 16 to 24 weeks of pregnancy, but now the schedule what we are using is as soon as the pregnant woman is coming for the first antenatal visit itself, we are giving TD, because if she is not coming for the other antenatal visits, and if she will commit directly during delivery also, at least she will be protected with first dose of tetanus and diphtheria. So for that, at first antenatal checkup visit itself, we are giving TT first dose, and after that 4 weeks gap should be given, and second dose of TT or TD we will give during pregnancy. So this is about the current pregnancy. Again, the woman, if she is getting pregnant within 3 years of first pregnancy, then no need to give 2 doses of TD. Only one booster dose is enough if the woman is becoming pregnant again within next 3 years. So this national immunization schedule is covering from birth to 16 years, as well as during pregnancy also it is covering. So government of India is giving all these vaccines free of cost in primary health centers, in health center sessions, and outreach sessions also will be conducted in Anganwadi centers or schools. Thank you.